Video 5. Involuntary motion sacroiliac joint function test. There are many physical orthopedic sacroiliac joint tests. Individually, they're not very accurate. Studies would indicate a battery of tests is more accurate. However, there is one that I find the most useful using the involuntary mechanism. Ultimately, experienced fine-tuned joint palpation is the ultimate guide, but the involuntary motion sacroiliac joint function test is a good initial guide and also a helpful guide during the treatment to determine joint clearance. Tuning into the involuntary mechanism is a skill that requires years of practice and appropriate tutelage and guidance. However, I'll go over the principles briefly. If you're already skilled in this area, it will take much less time to master. The IVM is a subtle energy field that mirrors the physical body and appears to have a rhythmic movement, similar in frequency to breathing. Palpating this movement requires being in a state of mind which paradoxically is almost the antithesis of trying to feel. Palpating the IVM requires the mind to be focused elsewhere. The IVM SIFT is performed with the patient supine. The patient needs to be completely relaxed. The practitioner lightly holds the ankles with their hands. The practitioner focuses their attention away from the room and passively receives the movement of the IVM of the lower limbs. The movement of the lower limbs is experienced as external and internal rotation. If there is a unilateral lesion in the pelvis, the associated lower limb will not move, or at least move less than on the non-lesion side. When the joint has been cleared, and this may take several cavitations, the IVM movement of the limb should be equalized. Again, this should be used as an adjunct to direct sacroiliac joint palpation, supine, side lying, or both.